and thank you for inviting me. I would like to apologize in advance because, as part of you are aware, Israel is under a fire, and in case of siren, I will need to leave and go to the shelter. But I hope that we'll be able to finish this presentation. The National Human Milk Bank of Israel is a new initiative. It is a national facility, and it was established together with the Ministry of Health. So actually, it is a unique entity in terms that it is combined with a massive, not massive, but we can say that we get money and some regulation out of the Ministry of Health. Also, we are part of the National Blood Services of Magen David Adom. Magen David Adom is similar to the Red Cross, and it is a national EMT service. I joined Magen David Adom in order to establish and to become the manager of the National Human Milk Bank of Israel. I'm a Laleche leader. I'm an IBCLC, International Board Certified Lactation Consultant. I also have a PhD in biochemistry, and actually I was very activist in terms of establishment of a human milk bank in Israel. But I chose to establish the bank as part of the blood services because I believe this is the way. If you want to promote it massively and to make this a huge improvement from zero, that there weren't any milk banks in Israel, and to make the improvement that everybody will start using it, that approximately 30 hospitals in Israel that have neonatal intensive care units. And I really needed the support of the blood services and the Ministry of Health. I also would like to say that after 2 years or so in the row, I was asked to become also the director of the cord blood service. So I'm the manager of two banks. One of them is the milk bank, and the other one is the cord blood bank. And I think I can get some synergy out of this, trying to run them at the same time and to be manager of two very opposite milk tissue banks. So as part of the blood services, it was very important that we will put an emphasis on the safety and the quality, and the Ministry of Health asked us to pay attention to the price. And of course, as a Laleche leader, it was very important for me to look for and keep on the breastfeeding support. I'm telling all that because we started working on the milk bank just before the COVID pandemic. And my main slogan when I give lectures and stuff is that human milk is not a food. It is a tissue. It should be treated as a tissue. It's extremely important because it is a living tissue. And I emphasize that although breastfeeding provides the most, let's say, the best or the very up-to-date, very contemporary, all the time with the infant, nutrition to the infant, we should make sure that milk banks will do their best to preserve the nutritional and the unique properties of human milk. And I kept on emphasizing all the time that although we need to pasteurize the milk, bovine milk lacks a lot of the unique properties of human milk, and we shouldn't just look at it as a food. It is not a food, it is a nutrition. And in terms of human immunology and human physiology, there is a big difference. So, and while I'm giving the lecture and trying to promote the unique properties of breastfeeding and the unique properties of human milk, the unique support that human milk can provide to the entire premature infant, not just in terms of neck or let's say in terms of other diseases and other abnormal conditions. I gave emphasis again and again and again on the unique property of the immune components of human milk, that most of them are preserved during pasteurization, and the fact that this is not the food. And then came the pandemic, and it was quite unique in Israel, the pandemic. Part of it because I was recruited to help in the blood services, and I helped them to establish the plasma collection of recovered patients. And immediately everybody asked me, what should we do about the milk? What should we do? And I said, we have 10 days to think about it. Let's focus on plasma collection, and I helped them. Meanwhile, everybody talked about that we should practice hygiene, respiratory hygiene, we should wear masks. And it was very difficult for me as a La Leche leader to even consider the fact that breastfeeding and hygiene can coexist. Because when you're breastfeeding your infant, you should be in close touch with it, you should kiss it, you should, there's an exchange of saliva, and it is extremely important in terms of the immune protection of the infant. And it took us about approximately 10 to 15 days. And things in Israel were not very bad in the beginning. You can see that it started at around March 20, and there was a very slow increase. And by the way, the current situation in Israel, you can see it on the right hand side of the slide, is extremely good. There are only approximately 60 new cases each day, and Israel is a small country, but nevertheless, this is considered a very good situation. And actually, so it took us a year or so to understand how to try to solve the issue and how to overcome the pandemic. And again, Israel is a small country, it's an isolated country, and it is easier to solve many issues such as pandemics. The Ministry of Health in the beginning talked about several trajectories that should have help us to solve the issue. There was the traffic light plans that each city was colored in a different color, and red is extremely bad and green is good, like many other countries. We had an app called the Magen, the Defender, that it kept sending us information and provided information whether you were being exposed to COVID patient, but nevertheless, none of it helped until we got the vaccines. The vaccines, it's Pfizer vaccine, started at approximately mid of December. And I must say that in 14 days, most of the medical staff were already vaccinated. There was no question of whether to do the vaccination or not. I know it is unusual, but it seems that everybody in the medical community and the Ministry of Health were very sure that this is the way that it should be done. And you can see the rapid stop of the COVID patient, and approximately in a month or so, we already noticed the decline in the numbers of COVID patients. So actually, I can tell you that the current situation is quite good. Most of the population is vaccinated. Most of the mothers are vaccinated, and it was very, very fast. And I think that we had no time to think or to consider whether it is safe or unsafe, because there was a huge wave to do that. And but regarding the fact that I should have received a donation, and I am part of the blood services, and the regulation regarding blood donation or plasma donation are very, very different from milk donation. And I was asked, what can we do? Actually, it took me a while to understand how to overcome it. And I used a term that is used in the blood banking, which is called pathogen inactivation. And I told them, look, pasteurization is pathogen inactivation. We shouldn't be afraid of any pathogen in the milk. And actually, I can say that it worked very, very well. Once I knew the right term, I was able to convince the ministry first and the physician and the blood services that we should be able to use a different regulation than of blood donation, because we have pathogen inactivation. And indeed, in the beginning, they asked me to keep the milk in quarantine, but after 3 weeks or so, I told them I need the milk, we need to use it. And they said, okay, so you can use the milk, you have the pathogen inactivation. We should also keep in mind that we always collect milk from the mothers at home. So we had no problem with that. And the only thing I can say that we had less mature milk donation. We had a lot of premature milk donation. Sadly, part of it due to several deaths in NICUs, some infants due to COVID-19, and some due to other reasons. But we got plenty, not plenty, but more than 10 very, very big milk donation due to deaths of infants. Regarding the vaccination, again, there was a huge wave of vaccination in Israel. We had no time for doubts or concern. The Ministry of Health immediately said that it is safe for breastfeeding mothers. We had very serious cases of mothers, pregnant women, delivery, who were very, very serious conditions, and it helped the public understand that we should do the vaccination very fast. And this is why there are several papers by Israeli, Yarden, Golan, who check is it safe? The messenger RNA vaccine, are they safe? And just several days ago, they published the study that of vaccinated mother. We have plenty of data, because again, most of the population in Israel is vaccinated with the same vaccine, by the way. So it is very good for statistics. And I can say that during the COVID-19 pandemic, I always say that many things can wait, but the child cannot. I was able to promote the use of donor milk. Once I understood that we should put an emphasis on the term that it is there are no pathogen inside, because most of the medical community were not aware of the effectiveness of pasteurization. The other issue was the fact that there was a big emphasis on the immunological value of human milk before the pandemic. So it was just natural to put a more emphasis on the immune advantage of it during the pandemic. And I can just say that the human milk of Israel is now approximately 1 year old. We are working in Jerusalem. And we had to adapt to this special situation in Israel. We had the COVID-19 pandemic. Now we have a semi-war position in Israel. I had to, I believe that part of you saw the picture. We had to deliver milk to hospitals in the south part of Israel that are being under fire, and I mean massive rockets, approximately 10 to 15 every hour. So it is a bit dangerous, and it was very important to me as part of the blood services to make the equation that milk equals blood. If blood is vital to human health, so is milk. And I'm happy to say that I think that the message was understood. I think that we are getting better responses from physicians in Israel. The public is also becoming aware of the importance of human milk, and I hope that in times of peace and no pandemic around, we will be able to do better and to deliver more milk to the entire state of Israel, which is small, but it is not easy country to live it. And someone asked me, and I will finish with that, in the national blood services, and we are part of it, we are receiving, the only criteria to receive milk or blood is the health of the donor. We have the blood and the milk of Muslims, of Christians, of Jews, and of course of Jewish. We combine them together. We do not distinguish between milk and milk, between blood and blood. And the only emphasis that we have is if it is a good milk, we will deliver it. We don't care whether it's Jewish or Muslim. It is extremely important for me to make this statement. So thank you so much. And again, thank you for inviting me.